Hey everybody, Dr. John here. Today's video is going to be an introductory video to the spinal cord, a bit about how it works, some of the anatomy, spinal cord injury, and some of the medical complications that are caused when you have a spinal cord injury. Today's episode is sponsored by my good friends over at iBidet. Coronavirus, pretty bad thing. When I first heard about coronavirus, I did what any good American does, ran to the store and just bought a truckload of toilet paper. In hindsight, didn't really need to. Could have just bought an iBidet. That's iBidet. I before anything is cool. When you go to the bathroom, you sit down, it knows who you are, what song you want to listen to. It starts your coffee. I start my day with iBidet. Think you should too. The spinal cord, it's really important. Right now, you're listening to me. The words are coming out of my mouth, they're coming into your ear. You might be looking around the room. You might decide to go for a jog. Any of those thoughts and decisions have to be carried out through your spinal cord. The spinal cord is kind of like a highway. There are paths and lanes that go in both directions. Things are communicated from your brain down and from your environment back up. My decision to move my finger like this, it's a lot of fun. You should try it. How does that happen? Neuron is connected from my brain, travels down through my spinal cord, and then enters actually a peripheral nerve at the spinal cord, goes out to my hand. Felt it was cold, the receptors in my skin send that message up through my spinal cord, and I get the message in my brain, hey, I better wear a jacket today. What if you're walking on hot coals? It's a cool thing, makes people think you're cool. Don't do it. You decide to jump off. It's a reflex. Your spinal cord's important for that. Let's talk about some anatomy. The spinal cord rests in your spinal canal. Your spine itself is all of your different vertebrae throughout your body. You have your cervical vertebrae, your thoracic vertebrae, your lumbar vertebrae, your sacral vertebrae. The spinal cord itself runs through them. If I bend forward, if I bend to the side, if I twist, the spinal cord doesn't get damaged by me doing those things. There are intervertebral discs. Those are the discs that can get herniated. Those provide kind of a cushioning. There's big muscles that stabilize the spine. How does the spinal cord work? Neuroscience allows for messages to travel through nerves. An electrical signal is generated. The body uses chemicals. There's a certain balance of sodium, potassium in the axon of your nerve, and the sodium and potassium shift. And as this chemical shifts back and forth, it sends a message down the length of the nerve. The spinal cord innervates different levels of your body. We call these myotomes and dermatomes as far as what part of your body is going to be functioning. Depending on where your injury to the spinal cord is, we can predict what parts of the body will not be working as well anymore. So unfortunately, people get spinal cord injuries. We classify them into two broad categories, traumatic and non-traumatic. Traumatic is exactly what it sounds like, falling from a height, car accident, any kind of foreign body entering. And then there are non-traumatic spinal cord injuries, such as tumors developing within the spinal cord, infection of the spinal cord, a stroke in which blood supply to the spinal cord is interrupted. When someone has a spinal cord injury and they're brought into the hospital, we do a test. We perform what's called the ASIA exam after they've been stabilized. The ASIA exam is a system by which we grade the injury. We assess what's working, what's not working, and this has important prognostic value because there are statistics that allow us to determine what a person's level of function is going to be after this injury. It's really important to protect our spinal cord. We want to wear helmets when we're riding a bike. We want to wear a seatbelt when we're driving in the car. We don't want to do things like bungee jumping or operating heavy machinery while under the influence of alcohol or drugs. These are just unfortunately things that people do and ways that spinal cord injuries are caused. In terms of the pathophysiology of exactly how the spinal cord gets injured, you can think about it in a number of ways. It's a wrapping of lots of little threads, which are nerves and even smaller as the axons. And if those get interrupted, the signal can't get through. So in a traumatic injury, you can have one of the vertebrae, which is the bones of the spine, can shift, and and, just knock into the spinal cord and disrupt it. You can have a shard of glass pierce through the spinal cord, a disc from a herniated disc, push on it. It's really, really delicate, and unfortunately it can cause a lot of dysfunction. There are a lot of unique injuries and medical problems that result from a spinal cord injury. In autonomic dysreflexia, the following might happen. If I were to step on a thumbtack and my foot gets the pain, immediately it sends a signal up through my spinal cord. There's an emergency, my body's in danger. Well, eventually my brain realizes, hey, this is not the worst thing in the world. We can calm down a little bit. Let's just not stand on something sharp. But what happens in a spinal cord injury is that the brain gets that message to calm down, let the heart stop pumping so fast, lower your blood pressure. It tries to send the message to calm down to the rest of your body, but your body's not able to get that message. And as a result, your blood pressure just keeps going up. And if you don't fix and identify the problem that's upsetting your system, you can actually die. You can have a stroke. I could be sitting in my car and really have to go to the bathroom. We've all been there. It's not pretty. Can't do anything about it, so you just hold it in. Your heart might start pumping. You might start getting a little sweaty. But your body, it knows that it's not the end of your life, keeps it in check. If I had a spinal cord injury at a certain level and I had to go to the bathroom, my heart would just potentially fire away. It might actually stop pumping as fast, but my blood pressure will just go up and up and up, and I can actually have a stroke. Other issues in spinal cord injury: damage to the digestive system. I eat food. Normally when I eat food, it goes into my stomach, it gets passed along through my small intestines, various portions of digestion and absorption occur, and then eventually I pass it out. In a spinal cord injury, the food might not pass through adequately. You might not be able to release the food from your rectum. It would be stool at that point. There's also neurogenic bladder. You're actually not able to urinate appropriately. The reason for that, the bladder needs to contract, and the sphincter at the end of the bladder needs to open up. Your spinal cord is responsible for those functions, might not be able to happen. There are metabolic issues with spinal cord injury, blood pressure issues with spinal cord injury. I just want to end on a positive note. It's 2020, and we fortunately have really good medicine nowadays, and we have really good rehab nowadays, and there's really good technology and research and lots of good things going on that allow somebody with a spinal cord injury to function and lead full, rich lives. People that go through spinal cord injuries, they have to work really, really hard to overcome some new challenges, but they are capable of doing it. And we can all learn a little bit about what they're going through and work hard on our own challenges and whatever our own health obstacles or things that we want to take on. The same energy, if we put that energy into what we're doing, learning more about spinal cord injury, I think will help us achieve more of our own individual goals.